Welcome back, ladies and gentlemen, at the fourth CII Senior Care Conclave. Welcome to the first session on digitization empowering senior citizens. The session is moderated by Ms. Nidhi Chawla, co-founder of Silver Talkies. Silver Talkies is a social impact organization that has been pioneer in active aging space, being operational since 2014. Nidhi believes, or she's very passionate about working with seniors and firmly believes that in this fast changing society, seniors need to be self empowered and take charge of their own well being by staying active and productive engaged. Welcome, Nidhi. You have a very difficult task because these discussions are very active and vocal. Um, we have Mr. Vaibhav Tiwari, COO of Putia Medical. Welcome, Mr. Tiwari. He has over 18 years diversified experience in building new businesses across industries such as business process outsourcing, technology, and supply chain management. Welcome, Dr. Karthik. He is the Managing Director, Atulya Assisted Living and Home Health. He holds a Master's in Health Administration from USC Price School of Public Policy and Bachelor's in Medicine and Bachelor's in Surgery as well. Welcome, Dr. Karthik. He is a health strategist and process improvement leader. Then we have Dr. Mala Kapoor. Dr. Mala is a sociologist, health and gerontologist, health and development social scientist. She is nationally and internationally known sociologist and now based in India. She was associated with University of Delhi as a faculty member and have over 37 years of experience. She represents both academia, research, writer, and an activist. Currently, as an international consultant, she is working for many organizations, giving them her inputs. She's also done few monographs for WHO, UNFPA, and UNOC. We shall also be shortly being joined by Dr. Kiran, Associate Professor of Department of Community Health and Coordinator, Health Services, St. John Medical College. Now I hand over the mic to Nidhi. Please take over.
Thank you. Thank you, Swati. Hearty welcome to everyone, to my panelists, Dr. Mala, Dr. Karthik, and Vaibhav. Thank you so much for being here, and to all those who are listening in today, and CII especially for organizing this annual Senior Care Conclave and putting the spotlight yet again on this emerging industry, which really has still a lot of work to do. So thank you so much. So a very warm welcome. And as I was listening to today's morning session, and while even I was kind of reflecting on how these last 2 years have been, I was reminded of a event, our big mega event that we did sometime February 2020, where Vaibhav was also one of the panelists, and we were talking about aging at home and beyond. And I think after that, suddenly everything shut down when COVID struck, right? And it was like, how they say, necessity is the mother of invention. I think necessity in this case has been the mother of innovation, because the kind of changes that we have seen, not just from service providers or the organizational point of view, but even from the seniors or the users point of view in the last 2 years has been really immense. And just talking from the Silver Talkies example, like, pre-COVID, we were a Bangalore-based organization which was organizing engagement programs for seniors, because our focus has always been on active aging. So, we had the center which was running at one of the Rotary clubs, which we called the Silver Talkies Adda, where it was a 3-day center where seniors in the neighborhood would just come down and engage in activities that were being done for them. And suddenly it all came to a stop. And the digital onboarding that required them to adapt and learn so swiftly and quickly post-COVID was an eye-opener for all of us. There was a point in time where we were struggling to figure out what do we do now, because we knew our seniors were so used to the whole physical model. That virtual model was really unthinkable. But kudos to them that they actually adopted so quickly, and they took to Zoom sessions, and they really went all out. So starting from staying engaged to staying connected, virtually connected with your families and your loved ones, to figuring out how to run your errands online, given that they just could not step out, to managing their healthcare, and even adapting to the payments, which is such a overwhelming phenomena for many of them. How to take care of their payments and even deal with the cyber security issues, and also so there was so much to learn, that it was really amazing that how they actually did. But there is still a large segment of them, even the people who were associated with us at Adda, who actually could not really take up the challenge. They decided that, okay, Nidhi, we love what you do, but we would like to wait. This is not for us. We really cannot do this. It's too overwhelming for us. So I think it has been a mixed experience, where some of them really could utilize technology to keep themselves engaged and not let loneliness or depression, which are really public health issues right now, really reach them, to some who actually felt left out. So it's such a mixed double-edged sword, I feel, where it has helped some, whereas some have been left behind. And I think it's a very important topic that we are covering today. And when Matthew was talking in the introductory section, that how there is such a large segment of seniors which still needs to be digitally educated. And he was requesting the ministry that the digital education is something which really needs to be a part of the agenda. So, so I would like to now invite my panelists to really step in and share their views and how from their experience, because all of us are from different industries. So let me start with Dr. Mala, given that you are a gerontologist and you have a better understanding of the needs and wants of seniors. If you could tell us, what do you think about today's topic?
Good afternoon, everyone. Thank you, Nidhi. Happy to be part of this important session, not because it is very topical, but because I see its relevance on the lives of older people in many ways. It has social, health, economic benefits, and getting impacted by the advantages of being empowered digitally. It adds on to the feeling of well-being in its broadest sense, thus contributing to better quality of life of older people. Now, why do I say this? Because based on my research at the grassroots level, at organizational level, I see the change that has come in the lives of older people, both in rural and urban areas, due to use of digital technology and devices in everyday life, significantly during COVID times, but also otherwise. I have seen in some villages in Punjab, in small and big towns of Gujarat, in metropolitan cities, Delhi, Chennai, Hyderabad, Bombay, Pune, the increasing use of digital devices, gadgets, assistive technologies for managing day-to-day life, accomplishing household chores, meeting health needs, making social connections, interactions across generations. The widespread of senior citizens associations in many areas connecting through WhatsApp, internet, Zoom, Skype for addressing various needs is very encouraging. I see telemedicine becoming popular through more and more in some states than others. I see day-to-day life becoming easier for senior citizens due to use of digital means in different ways in rural and urban areas. But the pertinent issue for me is, what is the percentage of these empowered social citizens in our aging population? This is a point to ponder. Focusing on the topic of the session, digitization, empowering senior citizens, I agree it is a powerful strategy to be adopted by all aging societies. And few countries closer home in Asia, like China, Hong Kong, Korea, Malaysia, Singapore, and Thailand, are very good illustrations of good practices. However, what I want to stress and bring to everyone's attention is that there are numerous challenges with regard to empowering senior citizens digitally. First of all, is the question, Do senior citizens have digital literacy to deal with digitization happening around them in the field of health, financial inclusion, building social communications, developing skills for managing daily tasks, and strengthening generational relationships? The answer, I think, is that large majority of senior citizens, especially women, cannot access digital means which can make a difference to their lives. Pivotal to the discussion today is what, for me, is how the governments, the civil society, people as citizens, what are they doing to hasten the involvement of senior citizens with digitization? Do we have policies, programs in place for their inclusion in the digitized world? Unfortunately, in the government's national digital literacy mission, which aims to empower at least one person per household with crucial digital literacy skills, senior citizens are missing from the plan. It is imperative that they be included. Further, let us give some thought to what processes are there in our society to prevent senior citizens from fraud due to digitization, which we know has a strong possibility of happening unless the person is aware of certain safeguards. My concern is that we do not have enough data on seniors to understand the impact of digitization on them. Are there statistics available on how many senior citizens are connected with digital processes in different fields in rural and urban areas? What is the quality and reliability of access to digital means available? Are they affordable by senior citizens? And another issue which comes to my mind is, what kind of digital skills should senior citizens have which can equip them or help them navigate things virtually or online? I, for one, am for opening digitization process for senior citizens, as it is the need of the hour in contemporary times. But let us begin with overcoming the challenges with innovative approaches, incentivizing the government, the industry, to have inclusive policies and programs in place. Nidhi, I'll just stop here with this introduction and let others come in and then maybe come in later. Thank you.
You've raised some very pertinent questions. You've asked very important questions. I'm sure Dr. Pritish will be able to build up on that, given that he, with his experience at St. John's Hospital, being associated with the geriatric department, works with seniors day in and day out, and not just the urban seniors, but in the rural areas as well. Dr. Pritish, can you hear us?
Yes, Nidhi, I think, I was a little delayed to join in. I've got a little bit of a patchy connection because I'm currently at one of the government offices involved in an audit of COVID-19 deaths. So I've connected from here, but just let me know in case, I'm not audible. Am I audible clearly?
As of now, yes. As of now, you are.
Okay, wonderful. So I totally concur with Mala's thoughts with regard to the need to extend digitization and to include elderly as far as digitization is concerned. I think the COVID-19 pandemic has been one of the greatest proof that digitization is really required as far as elderly is concerned. Given the fact that there has been evidence from multiple places. In fact, there was a study by HelpAge India, which was done in multiple states, and looked at the impact of COVID-19 on elderly, as well as the lack of digitization among the elderly. So it was found that there were a large number of elderly who were not able to cope up with the needful changes that occurred due to COVID-19, right? So things like banking, or things like probably booking appointments, and multiple other such aspects actually went purely online during the epidemic, especially due to due to the various lockdowns. And the number of elderly who felt challenged and who were not able to actually fulfill some of these obligations that they had was quite huge. Coming to the aspect of digitization in general and not necessarily related to the COVID-19 pandemic, we in St. John's work in a number of rural areas. So we have clinics, in nearly around 11 rural locations, which are distributed, around St. John's. And these, rural locations, we come across a lot of, elderly who close to around 2,500 elderly, are registered with us, in these clinics, and they actually, see us on a monthly basis. And what we do find there are certain issues that are very, very important for us to consider, especially if we, look at the aspect of, digitization. So we have a large number of these, elderly who are illiterate, right? So we're not talking about computer literacy, or we're not talking about, gadget-based, literacy. But in general itself, the literacy levels are low. So they are not able to read and write. Secondly, as such, the use of gadgets, especially the newer gadgets, with regard to let's say smartphones, or going a step higher, the use of a computer. None of these are things that have been undertaken by these elderly, and I think no attempts have been made to be able to try and facilitate the utilization of such gadgets for these elderly. So much so that it is not the question of them not being able to use it because they don't know how to use it. There are also concerns of affordability as far as this segment is concerned. So that is one bit. The second is the various medical issues that are associated with these elderly. So many of them have some amount of cognitive decline. Many of them have issues of vision, issues of hearing, right? So they have multiple such issues which make it difficult for them to be able to use digital devices. So what I'm trying to get at is, I think there needs to be a move to be able to make some of these digital devices, as well as incorporate modalities which are more elder friendly, and which are also taking into consideration the socio-cultural backgrounds of most of the elderly in our country. To be precise, I think 70% of our elderly are actually from rural or underprivileged backgrounds, right? Now, even in the remaining 30% of elderly who are from urban backgrounds, or possibly who have a little bit better socioeconomic status, these elderly also find it difficult to be able to access devices, given the lack of knowledge, given the lack of initiative to be able to probably help them access these devices. So it would be wonderful for the government of India to be able to look at an initiative by which such elderly can be included, to be able to ensure that digital literacy is improved, especially in this section of the society. So with this, I think I'll pause my thoughts and probably join in later with a couple of comments after the rest of the panelists have spoken. Thank you, Nidhi.
Yeah, thank you for adding on to those comments from Dr. Mala as well. Thank you so much. Vaibhav, I'll come to you next. Given that OTR caters to the home healthcare segment, right? And I think catering to seniors who were homebound, home healthcare played a huge role. Now, from digitalization point of view, how easy or difficult was that, both from an organization point of view and also from the user's point of view? I would love to hear your inputs.
So if you look at our journey as an organization in last, we have been in what we call outside the hospital healthcare area for last 8 years or so now. And of course, the journey has moved forward, and I would look at digitalization not only for elderly, but otherwise in healthcare also overall. So if you look at just from a healthcare digitalization perspective, it was not that penetrated maybe like first 5 to 6 years, but I would say that other consumer services will start using digital quite well, whether it's food delivery and cab hailing and things like that. It starts changing consumer behavior overall. And that's something which has been making massive inroads even in how healthcare has been or was conceived to be delivered, right? Especially primary healthcare. And the last couple of years with COVID coming into play, I think the pace of what digital health can do in for consumers or what you call patients got basically fast tracked significantly. So you always say that what demonetization did for digital payments, I think is what COVID has done for digital healthcare overall, right? So that is something which we have seen massive changes in the last couple of years. So, and the changes from a consumer behavior perspective have been irreversible now. So, I mean, we had wave 1, wave 2, wave 3, and people realize that, okay, now this is a method to use. This is not an option to have acting. And if you look at whether it's teleconsultation, whether it is using point of care devices, whether it is, and that's a big part of digitalization, is that how can you use patient health data to help them recover faster or basically help them manage their health? I think acceptance of that, saying that okay, my health data can be really, really useful for me in my treatment. I think that acceptance also a very big part of digitalization. So in last couple of years, and each wave has only reaffirmed that, each COVID wave has only reaffirmed that. And I think the change has happened at every consumer level. And the change also started happening for elderly. So, I mean, in last couple of years, the elderly in general and anybody who's immunocompromised, like a oncology patient and patients who are on dialysis and things like that, for them getting to hospital became a real no-no, right? Because they was the most vulnerable segment. And of course, getting to hospital and not taking care of their health at home was not an option anymore. So I think that is one thing where we saw tremendous acceptance of using healthcare at home and using digital methodology, right? And second thing which became important is that elderly population with chronic disease, I think, is the most vulnerable segment, right? So also, how do you manage your diabetes? How do you manage your hypertension? How do you manage your sleep problems? Taking care of that as a must do also became that much more important. So one is that you have to take care of your health because of age. Second, you have to take care of your health because of chronic disease, because a combination of the two is basically making elderly a lot more vulnerable to basically diseases like COVID. And then, of course, availability of digital channels to take care of a health is open today. I mean, if you see last 2 years, that particular thing has continuously gained momentum. So, of course, people are taking time to learn, and even in our experience, even elderly taking time to learn. But I think in the last 2.5 years, I think we started the first wave of COVID came in December of 2019, right? So from then to now, we are almost 2 years, 3 months. And as it has continuously happened one after another, each of these waves, we are seeing elderly population also changing in their approach towards digital. So their acceptance of, okay, this channel works. So first, of course, say, I have no option, let me try. You try it 1 time, 2 times, 3 times. It's not a short duration. It's not one event. So if you ask the same question, end of 2020, this is something which was like a probably change waiting to happen fully. If you ask the same question last year, June, July, this change was a lot more reaffirmed. If you ask that question today after wave 3, people believe, okay, this is something which is there as an option to take care of my health. And it works for me because I have seen it. And we saw that in 3-4 areas. And I think the acceptance has continuously grown. One is that how do you use digital channels like a video consult? We do video consultation for doctor video consultation. We have done physio video consults for patients with greater and greater acceptance across age groups, including elderly. Second thing is that how do you use point of care devices? I mean, wearable devices. A question which was like a no 3 years back is a question which is basically up for pilots now with enough elderly population whom we are serving. So that's a point number 2. And point number 3 is saying that are they open to their data being shared and data being used to help them to recover faster? I think that again acceptance is much higher. Other thing which I would like to add is that especially urban elderly, many of them are also, or even rural. I mean, we are not doing so much for rural population, but elderly in general, their children are a lot more interested to take care of their parents' health, right? And having digital access to digital data and records and basically availability when they are not there on site with their parents all the time, the convenience with the children are experiencing to take care of their parents' health is a lot more now. And of course, their influence also on their parents to make sure that they start using digital channels of healthcare is much higher today because of the convenience which children and security which children are feeling with the data which they can get for their parents. So I would say it's probably it are probably stage 2, stage 3 today. If you were to have like a 4 of maybe 5 or 6 stages of digitalization for elderly, I think we are already a stage 2 or so. And next 3 to 4 years, we believe that for elder care, I think the digital penetration will be lot faster and lot more all pervasive.
Thank you, Weber, for sharing that. Dr. Karthik, over to you. We would love to hear how has been your experience from the assisted living space point of view.
Thank you, Nidhi. So broadly, I want to touch on technology adoption as a whole, right? I mean, talking about the elderly population, unless you demonstrate the value to them, anything you're going to push it on them, they're not going to accept it. So broadly, I think the first thing you want to touch is in their health and well-being. Are we able to add value to when we bring in technology into their routine lives, which could be as fundamental as checking their vitals, their sleep patterns, medication compliance, mental health, physical activities. All these are something that's very, very important on a day-to-day basis of an elderly, where if we are able to capture it in a user-friendly, without much of nuisance or pressure on them, adoption happens very quickly. So this is something that we have done practically, and we have realized how to go about it on a stepwise. So first, on the vitals monitoring, today we monitor vitals still in a traditional form, right? You want to go and touch them and ask them to sit up or lie down. It's not something they really enjoy. What if there is a technology available that is a sensor that goes without any contact and able to monitor that? Just a question. We are using something from the market, but it is available. And second, going about medication compliance. I'm going something very specific because we are into more of facility-based care and more deep clinically, and we are able to show progress with them with technology adoption. Second, touching upon medication compliance is a very, very important factor when it comes to elder care. What if we are able to have an automatic pill dispenser where instead of just sending a mobile notification, the pill dispenser opens up at 7 a.m. in the morning. And once you take the pill out, it sends a signal that they've taken the medication. Still, there is some gaps, right? But at least we're one step further than giving them a strip of pills and say, take this on a Monday morning, 7 a.m. Again, these all have to be transformed to more accurate systems, but this is just a step in progress. So we piloted this because when these informations are not available, for example, on medication compliance, the care providers are not able to take the right decisions. When elderly gets sick, they go rush to the emergency room. The emergency physician doesn't have information if their medication compliance is good, if their basic monitoring has been good. So one is capturing information. Second is passing the information to the entire community of care providers, such that decisions are taken in a data-driven manner, not in a very impulsive at that point manner, where it could totally go in a different way. Moving on, third is overall on the physical activities and mental health. Today, when you say physical activities, all goes about wearables. But practically, when we try to implement wearables in the elder care population, honestly, we failed. We tried several devices. It could be as realistic of wearing it. It's not about wearing it, it's about charging it. I mean, do they have the time? It comes to us also. I mean, I forget sometimes to charge my smartwatch. But imagine on a situation of elder. So we have to really understand what is important for them and how do we push technology to them in capturing the right information without adding pain. So what if the same motion, we have a motion sensor on a wall where we're able to capture activities without asking them to wear a wearable, where it is without touching them, information gets captured, and you want to know how much they walked or how is their activities, if they're too much spending time on the bed. So we're again piloting something similar. Of course, scale is always an issue when it comes to cost and technology adoption and user friendliness. So, but this is a step in progress. But to summarize, what I will say today, technology is available. It is available in a manner, it is very fancy, more tailored to the younger generation and not mindful of the elders. And on the secondly, at a leadership level today, at least from my perspective, from what I know, it ends up at a boardroom level. It doesn't go at a grassroots level. I think as all leaders from the senior care industry, we should take a step towards going into deep in every touch points, and not use it as a marketing tool. Because ultimately, once you start showing value to each and every customer that you're serving to, they're going to start using it. So we put a small steps in progress, Nidhi, but in the interest of time, I'll pause here. I'll come back if more questions need to be answered.
Thank you so much, Dr. Karthik. I actually, many interesting points emerged through, what all of us spoke. And in fact, Dr. Karthik, you painted such a beautiful picture of, I could actually visualize where everything was so technologically, seamlessly implemented that everything could be handled, so beautifully for seniors, making their lives so comfortable and convenient. In fact, it just reminded me of, how Japan is at the forefront of employing these robots, right? The socially assistive robots, and how they are even, they as pets give company, they talk to the seniors, and they even kind of lead sessions for them, activity sessions for them at the assisted living homes, and giving respite to the caregivers who have their hands full, because we all know, even in our country, there is a lack or paucity of trained caregivers, and skilled workers are a rarity right now, right? So if technology can kind of build up and assist them. So in fact, my question to you would be, Dr. Karthik, that in your view, how has technology really helped the caregiver? Has it really help them engage a senior better? What has been your experience there?
Yeah, I think the whole topic of burnout, I think you're touching, which is spoken across the world, even here, to go very specific to at the caretaker level. I'll give you two examples, right? In our setup, imagine if an elder is at fall risk, our rounding is at every 15 minutes. Imagine if a nurse or a caretaker has to walk into that room every 15 minutes to check if they're okay. Imagine what she's going through in addition to the other work the caretaker has. What if the same thing, if all we need to know is, are they trying to get out of the bed, right? That is the goal that we're trying to achieve while doing frequent rounding. Instead, if our sensor is able to alert us in our nursing station, the client has gotten out of the bed or is trying to get out of the bed. So that significantly dropped our overall burnout of our caretakers. Same thing about vitals. Let's say somebody has abnormality in any of the vitals, and the physician, when he comes during his round, he's going to say, monitor them closely, do an 2-hour roundly or a 4-hour roundly. It's very difficult. She's going to get shouted by the client, why are you bothering my sleep? Why are you disturbing every time? Opening my door, you're disturbing my privacy. Imagine the same thing is able to do by technology. All they want is information, not to go and disturb them or wake their sleep or their privacy. So this is something it's still in a pilot stage. Of course, still you scale accuracy, all have to be looked into, because the regulatory framework around continuous monitoring is still very on a gray side in our country. I would say there are a lot of technology available, but there's no standardization say, hey, if these devices are CE approved, you just can go ahead and use it. So framework is still, we're not able to get the confidence, but there are technology available that has helped significantly reduce the burnout of caretakers, which I just explained.
Vaibhav, this question is to you, given that you spoke about how teleconsultation and telemedicine, worked as a huge savior, especially during the pandemic time, right? But in your experience, is that something, I'm guessing it cannot really replace a physical consultation, especially, in certain situations. So how has telemedicine kind of coped up with that?
One is that there are situations like what happened during COVID, when you have no option and you use teleconsultations. Of course, this is the only way for an elderly to get consultation, especially for vulnerable health. But second, I think just as a concept, what it looks like is that it will start replacing certain follow-up consults, and of course also start replacing certain conditions in which you can do teleconsultation, right? So over a period of time, I would believe that maybe like 40 to 50% of the OPD consults could be converting into the teleconsultation. So that is something which is a possibility as per certain studies and reports, and that's something which is possible to move. So if you look at it if you look at last 2.5 years, it got tested. it got accepted, and I think this will become like a way of taking care of the OPD visits, at least partially, is what it will move towards teleconsults.
It would be like a matter of convenience, which will take over.
And of course, as the time will pass, you'll also have certain devices which are coming, which you can use to basically support patient while they are doing teleconsult, right? So I think the other thing which will work along with teleconsultation or video consult is that I think there's a massive investment and work going on the point of care devices side as well. So I think what will happen, the teleconsultation assisted by a point of care device, which can help a doctor assess the patient condition much better than what is happening today. I mean, in many cases, today you're telling your symptoms and condition to the doctor on a video consult, right? And he's making an assessment basis that. If he has devices which are supporting him in doing the assessment and which become more and more accurate as time passes, I think that whole accuracy and the credibility of teleconsultation will also grow multifold. So I think a point of care devices assisted video consults could be the future in next 5 to 7 years.
That, it reminds me of a point which Dr. Karthik had made, that while they are experimenting with various technology platforms, I think he spoke about how scalability can be an issue. So any points from both of you in terms of, as an industry, what is it that we need to make all this technology viable and available and affordable?
Maybe if Vaibhav wants to start, I can follow it.
Sure. So see, from the way I look at it as sort of industry and in our experience as an organization, I would believe that whether it's technology or the way we do any service, I think it follows when the consumer behavior starts changing. And I said this in my first few points also. I think the consumer behavior in general in using digital healthcare is irreversible now. I think even after wave one, nobody was sure is irreversible. I think now it's irreversible. So once consumer behavior starts changing, I mean, of course, all the providers will move towards to fulfill that need. And so today, of course, you look at all the technologies available. Is that fulfilling all that what is needed? Answer is no. But that's what I was saying, that maybe next 3 to 5 years, I think there'll be massive advancement and investment in healthcare technologies, and which will make it a lot more cost effective, as well as, of course, a lot more accurate and credible to use digitalization as a channel. But it all starts with a consumer behavior change, I think, which is what has happened in our understanding in last 2.5 years.
Nidhi, to add to it, goes back to what I was telling Nidhi is the regulatory framework. Today, if I have to go take a technology and implement it, either clients or the doctors ask me, is it US FDA, is it US approved, or what is the regulatory body that is approved this device? I mean, there's so much innovation happening on remote monitoring and sensors at India. Beautiful guys, fantastic guys are doing either in Bombay or in Pune or in Bangalore or in Chennai. But unfortunately, I don't know if I can use it or not to make decisions. So is there a guidance given to for remote monitoring or for home-based monitoring? What is something we need to accept it and take decisions? Because we do take medical decisions based on technology. So can it be a validated tool to capture, for example, vitals or sleep patterns to take a decision? I don't know. I'm still not confident. I would double check it by doing a manual examination. So I would say regulatory framework, if given, Nidhi, we will start using more made in India products than using devices from other countries, because bringing that down to India and using it is a very high cost and adoption is not easy either. So that would be my sense and experience sharing so far, Nidhi.
I may just add on, I also feel, some form of subsidies or some form of government support for such technology, like how Japan is really, the government is part of the program, right? They really go out and have been investing in such technology and have been promoting, making it accessible by assisted living homes to really utilize this technology, right? So in fact, there was a very important point that Dr. Pritish was making, and in fact, he's just turned on his camera right in time. Dr. Pritish, you mentioned that, how even though smartphones or phones may be available, but illiteracy is a very real challenge when it comes to serving the, as per socioeconomic groups that we have, right? And do you have any thoughts on how we can actually address that challenge?
Right, Nidhi. So I think the most important aspect is policy, right? So like Karthik mentioned, I think there needs to be a lot of policy change in terms of looking at how processes can be simplified as far as digitalization innovation is concerned, or penetration is concerned, or the usability is concerned, right? So all three components are important. One is in terms of what is it that as a country we can actually look at our settings, and what is it that we can actually invent to be able to use in our settings, and not necessarily just blindly take something from the West, because situations out there are totally different. Secondly, as such, if I actually invent such a thing, to in what way can I actually make it available or accessible to individuals? And thirdly, even if it is available and accessible, the cost of such a bit, the affordability, right? So that is something that we need to keep in mind. So as a country, I think if we are speaking of wanting to digitalize, increase digitalization as far as elderly is concerned, and given the fact that there is a large segment of individuals who feels that as far as digitalization is concerned, it is not being looked at as far as the elderly are concerned. So it is important for us to have that policy in place, wherein the policy makers look at implementing such a move. In fact, what comes to my mind is a very recent article that I read, which was just before the announcement of this year's budget, wherein I think a set of NGOs asked the finance ministry to consider a separate ministry to be able to look at digitalization, and especially from the elderly and the groups that cannot access digitalization, right? So from that context as such, there was demand to be able to look at things not broadly in terms of just something that is being introduced for digitalization, but also to be able to look at some of the context specific issues. So that is where I think the principles of primary healthcare, right? So when we talk of healthcare, very often I think we need to start from the roots, which is something that is made available and accessible and utilizable to all, and not just necessarily a section of individuals. I would probably say that the emphasis needs to be on certain components which are useful in day-to-day life to start with, right? So we actually call them the activities of daily living, more so the instrumental activities of daily living. And first we look at some of those processes which can simplify the lives of individuals. Let's say mobile phones, or the utilization of various devices itself for various services. So how is it that these can be made accessible, or how is it that the reach of these can be increased, and how is it that we can actually have elderly utilize them in their day-to-day lives? So I would probably say that is probably the first challenge that one needs to look at, and not necessarily the complete broad spectrum of digitalization. That is trying to look at what is it that can be useful in the day-to-day lives of older individuals, right? The simplest example that comes to my mind is applying for a particular scheme as far as the government is concerned, right? So from the government side, let's say a senior citizen needs to actually apply for anything. Let's say starting from a driving license to maybe a senior card. The process of digitalization has come into place as far as these are concerned, but the processes are quite complex and difficult for older people to be able to follow, or to be able to actually implement. And I think that is where if some of these processes are simplified, and where the elderly also feel secure using some of these facilities, that I think would be a great initiative. So I'll stop with this, and probably have more questions later.
Dr. Mala, would you like to weigh in here? Because you also very emphatically spoke about the need for digital literacy combined with awareness, and also the whole fact about that data protection and protection of seniors against fraud is very important, right? And affordability and accessibility, right? So would you like to weigh in here?
Thank you, Nidhi. Yeah, so there are two aspects to it, and I want to just raise that. I mean, I do agree a lot with what Dr. Pratish said, but I think taken the Indian context, our cultural society, family plays a very important role. Elders don't take decisions on their own. Family members assist them to decide on something. So when we are doing this full process of digitization for elderly, we have to bring in the family as partners. We have to bring in our society an awareness amongst the younger generation for the benefits for the older generation, and encourage them to encourage senior citizens to use these devices, these gadgets, and all. So a lot of learning comes when the family advocates for something. So I think a lot of service providers must reach out to families, to generations, to include seniors in digitalization. The other thing which was touched upon by Pratish, and I want to emphasize it a little more, is that we must focus on practical implementation of things. How do we include aging population in digital literacy? Does it just mean deployment of mobile applications or information technologies for better delivery of services in sectors such as healthcare, social care, or financial services, or e-commerce? What kind of digital skill development programs are there for rural and urban populations? Because both, given their lifestyles, given the way they live, have certain skills which are required to adapt to everyday living. So I think what we need to is that, do we have proper understanding? And very importantly, I think we have to develop age-friendly, affordable digital infrastructure. Because as we do see that while families are there, but a lot of families are now working. Husband, wives are working. There's nobody at home except the maids to look after the senior citizens in urban areas. And even in rural areas, we are finding that senior citizens are very often left on their own to fend for themselves. So, I mean, what kind of facilitation there is at the household level to make provisions for services for senior citizens? How affordable a digital infrastructure, which makes it attractive for families and for seniors to do it? And although, yes, our government is doing a lot to strengthen internet networks and connectivity, but it is still not that universally available. We have a lot of problems with connectivity. You give them a gadget which operates on technology, but when the technology is not fed by certain connectivity, it becomes a failure and it discourages people from its use. So we can promote aging in digital era, provided partners come in and we all play a proactive role to empower the senior citizens and empower families to adopt to these practices. And I think industry partners or another organizations, NGOs, and all have to play a proactive role to have a community reach out to promote digitalization for senior citizens. And like what I had said, we must have many regulatory accountable practices in place, and TR, AI, and all have a very important role to play. So we have to develop a lot of collaboration and partnership if we want to change our country towards digitalization for older people or whatever. Thank you.
Dr. Pritish, I'll just come back to you because I think, given that we are highlighting the desire for, the changes that we would like to have in terms of what can be done more when it comes to making seniors more digitally empowered. But I'm also wanted to know from you, given that specifically you work with the, seniors in the rural areas as well, hasn't technology really played a role in, in a huge role in kind of making healthcare accessible to those seniors who are in rural areas where doctors or provision of healthcare is a challenge?
Yeah, well, I would probably, echo Mala's statement, with regard to internet availability and, penetration. It is still a challenge, in many parts of our country. I would probably, say that, yes, there are devices available, but connectivity and, various such aspects, right, are a challenge in terms of these devices, being utilized. Right, a classical example I can see, happening in this own meeting, because I'm finding it difficult to, actually log onto this meeting and connect, with my video. So I can very well, imagine the situation of a senior citizen somewhere, in remote Karnataka. But that being said, there are very encouraging aspects, which have been documented. So, for example, in the Northeast, there have been experiments, which have looked at the use of telemedicine to be able to reach out to some, villages and some zones which are quite remote and do not have adequate medical services, largely due to access reasons, right? So there have been multiple, such examples, which have showcased the use of telemedicine in some of these remote areas, and the utilization of this technology, to be able to help with some specialized care which is not necessarily available in these areas. Digitization of health records. Multiple areas, within the country have looked at health record digitization. So the example that comes to my mind is in our own field practice area, which is around 30 kilometers, from St. John's, which are largely rural areas. We have tried looking at records going digital. But the challenge, that we have found is that the accessibility of these records, in different settings, right? So there was a proposal that was put forward to have some sort of a unique ID for every person across the country, and including elderly as such, to be able to ensure that their health records are digitized, and anybody and everybody can actually access these records at any facility. So the challenge, currently that we have is, let's say that some health condition has been digitized in a corporate hospital, which is very large, and wherein all the records of this patient have been retained at that particular hospital, and the patient just has a small slip which looks at the medications which he or she receives. There's a challenge to follow up such patients when they actually come to other settings, or when they actually go to a smaller primary care setting for simpler problems, wherein many of these things are overlooked. So there are my suggestion would be in the various hackathons that are conducted across the country for technology, we can have specific hackathons look at how such technologies can be devised in order to be able to increase the reach and the coverage of these devices. Because yes, in my experience and in my reading, it is certainly useful in various settings where these devices have actually worked in these rural settings to improve the healthcare of the elderly.
I think Dr. Karthik wanted to add a point there.
Yeah, it's just a follow up to Dr. Pritish. Yeah, absolutely. I think into age tech is a big topic. But unfortunately, if I have a problem and I want to bring technology to solve it, I don't know really where to go other than Google it. While there are platforms and associations out there, but they might not know there is such a market for elders and there's so many operators. I mean, I think there is a body already in India. I think it's an extension of an international body called HIMSS, HIMSS. I don't know what is the relationship the Senior Care Task Force and the association shares. It'll be nice if such associations, or if there are any other existing, be nice to start integrating, because we also need to be educated on what's available in the market other than just going out and looking for it. Because it'd be nice. Let's imagine if I have a problem saying that I'm having frequent falls, I have only a system to tell me after a fall happens, what if I need a hip airbag, right? For example, right? But you Google it, you'll be able to find it. But it'll be nice if the platform is given for such players to come and showcase, and we as senior care operators can get access to it and at least have a look at it, either virtually. So that's something I want to put up on the table for CII also to look up. If we can start collaborating with technology associations specific to healthcare, where we could use some of it for our operations.
We are reaching the end of our time. I would just take this opportunity to ask Vaibhav if he would like to add anything before I round up the conversation today.
I would just like to add, saying that where we stand now, I think that I keep repeating is I think we are in the midst of an irreversible change. And what we see, and when I say next 4 to 5 years, the changes will happen, I also believe that many of the people who are technology savvy will also get into the elder care segment actually in next 5 to 7 years, right? So and I think in this using digital services, I think we already reached the critical mass from an elder care perspective, and we'll see it unfolding big time in next 4 to 5 years. That's our guess.
That's a very nice positive thought to end this session with, because if I may actually just quickly sum it up, I think what came out that there is no one size fit all kind of an approach that can take, given the diversity in the socioeconomic groups and how geographically diverse we are, right? But then we have started out on a great journey, and as Vaibhav just said, it's an irreversible change, and really, COVID has played a huge role in being a game changer there and in helping us pick up speed. But yeah, there is a lot to be done to make it accessible, make it inclusive and affordable. And I'm hoping things like voice-enabled services, which can even cater to illiterate people or can transgress the language barriers, or the wide languages that we have. There is a lot of work to be done on on this whole topic of empowering seniors through digitalization. So this is a good start. We have made a good start here. So thank you so much, everyone, for sharing your inputs and sharing your thoughts on this. It has been a great discussion. Thank you so much. And over to you, Swati.
Thank you, Nidhi, and thank you to all the eminent panelists who have joined for this session. CI is grateful for you to joining, and we shall be sharing this